Ben, buenos dias.
Buenos días.
Thank you for inviting me to your podcast studio. I mean, it's quite fun, like I said, to just walk around recording it, but it's really convenient to have one here. And like I said, this is going to feel weird because I'm interviewing you and you are in your studio. So it feels really weird. But do you want to like start presenting yourself and telling something about the clinic and what is the Regeneration Clinic of Panama, like an introduction to anyone that's watching?
Of course. So we are currently now at Regeneration Clinic of Panama. This is a stem cell-based clinic that has been open since 2018. We work primarily with umbilical cord-derived mesenchymal stem cells and mesenchymal stem cells-derived product. So we try to do biopharmacological product in a way to be standardized and have always the best, consistent, and reliable outcomes with all of our patients.
So one of the things that drew me here, that I decided to visit, is some like 20 years ago, there was this craze, this massive hype about stem cell treatments. Mm-hmm. I remember when I was a child and adolescent, there was all this talk that paraplegics were going to walk again. And then it all sort of kind of died down. People stopped talking about it. And then when I was coming here to Panama, I saw it's kind of a hotspot for stem cell treatment clinics. There are at least 4 that I am aware of. Mm-hmm. You are one of them. And so this is, I think, a great place to begin with. Why do you think Panama specifically has brought together this large amount of stem cell treatment clinics, and why has it grown more here than in other countries? For example, I imagine there might be some in Brazil, but I had never heard of one in Brazil, and I have here in Panama.
In Panama, of course. Part is that regulations make it possible to do this type of treatments here in Panama. The other part would be the geographical position of Panama. Panama is also called the hub of the Americas. So you can have a direct flight from anywhere in the Americas, almost anywhere in the Americas, directly to Panama. So that's one part. Obviously, stem cell treatment has been done here in Panama since 2008. So it's one of the longest standing, countries that have offered stem cells out there. So it definitely has been historically in the stem cell world a great place to do those type of treatments.
And how do you see, like, you were in stem cell treatment, you are inside this world. How do you see, like, this development? Do you feel like this just an outside view that the evolution kind of stalled, that there was this craze, this hype about it some 20 years ago, and then it kind of disappeared? Do you inside it, the world of stem cell treatment, feel like it? Do you think it just lost media attention? How do you see it?
We still see a lot of booming attention and success in stem cell treatment. So I don't see a decline in the stem cell treatment as such. What I do see is in umbilical cord banking. Because as you mentioned, at least over here as well, 25 years ago, there was a huge boom on umbilical cord bank. That, hey, you need to store your child's umbilical cord. Because in the event of having some accident or some condition 10 years, 20 years down the road, he will need that umbilical cord for his stem cells. So we have seen that market go particularly, lower, as it has a decline. But with stem cell treatment, there's, on a monthly basis, more and more patients looking for alternative, looking for solutions. Patients that have tried almost every known medical treatment that can offer at the moment without success. So usually that's when they start looking into stem cells.
It's interesting also because like some 10, 15 years ago, we heard a lot about like treating spinal cord injuries mm-hmm. with stem cells. And nowadays, if you go like on your website or on many websites, there's a long list of things that are treatable. Where did you start with? Did you start treating spinal cord injuries, or did you, for example, I see there are treatment for autism, for example.
Correct.
How does this timeline works? Where did it start?
Claro. So I think once you understand, at a much deeper level, what are stem cells and how they work, you will realize that you can use them for different type of conditions, different type of treatments. So if we look at the pathophysiology of the conditions, the mechanism of action, or how a disease comes to be, that gives you the entire insight or the tools you need to treat that condition. You know, I've never heard about stem cells in med school. So we're not taught about stem cells. The only time that I heard about stem cells...
May I ask, where you went to med school?
Here in Panama.
Here in Panama.
Here in Panama. The first time I heard about stem cells in med school was in embryology, anatomy, embryology, the formation of the embryo. So you have the true stem cell, the totipotent stem cells. Totipotent, that has the potential to build or create the entire human being. That's the ovule and the sperm. That first cell, that's the totipotent stem cells. Then as the embryo starts developing, the stem cells start specializing into subset of different products. So you have totipotent, then you go to pluripotent. They start every time more and more specialized, more differentiated into different type of tissues. Umbilical cord mesenchymal stem cells are pluripotent. Pluripotent, they have the potential to stimulate or differentiate into different type of cell lineage or different type of tissues. So the term mesenchyma comes from connective tissue. The mesenchyma of the organs, the mesenchyma of everything, connective tissue. What is connective tissue? Everything that holds you together. Everything. So you have the skin, you have the blood vessels, you have the ligaments, you have the tendons, you have the bones, nerve, everything that holds you together. So these are stem cells that are known to stimulate or have all of the information, basically, either to grow or to repair different type of tissues. So depending on your tissue affected, you will understand if this type of stem cells can be helpful or not.
So essentially, if you're going to treat, you can give an example of what you treat, for example.
Claro. For example, musculoskeletal joints.
So if you're going to treat musculoskeletal joints, if you have a degenerative joint disease, perhaps, are you going to try to insert cells that can differentiate into the original cells of that tissue, or are you more interested in the cytokines and the regulatory influence of these new cells?
Correct. That's a good question. So stem cells, when they're inside your body, they will not transform into your cells. That's not something that's going to happen. Some people previously thought that was the case. It's not the case. And even the first scientist that described stem cells, Dr. Kaplan, he later did an open letter. So, he wanted to change the name from mesenchymal stem cells to medicinal signaling cells, because that's how they work. They signal your own tissue, your own cells, to stimulate a specific response. So once you inject stem cells, and again, the joints are impossible to heal by themselves for the plain reason that they lack blood supply. The cartilage, the ligament, the disc, the meniscus, all of them, they don't get blood supply. If you don't get blood supply, you don't get the growth factors that you need to repair. For example, if I have a cut in my finger, it bleeds a lot, but within a couple of days, it healed. So once we inject stem cells into a joint, usually for the first time ever, that joint gets all of the growth factor it actually needs, or all of the signals it actually needs to signal a response, a growth or a repair mechanism.
So I think we kind of stumbled upon a major point here, which you mentioned, and it's something that perhaps is often overlooked. You don't do anything that's autologous. You never take any cells from the patient to inject them in another place, for example. All your stem cells are collected from umbilical cords.
Correct.
So that's the expectation. You don't expect the cells to differentiate into anything. You're using them for their regulatory potential, for the cytokines, for, vascular endothelial growth factor, whatever they are going to produce. You are using them as cells, but it's almost like you are injecting substances, just like someone injects, for example, a corticosteroid to have a local effect. You are injecting the cells, anticipating what they are going to produce.
Correct.
Yes, that sounds, perhaps for you, it sounds like, a trivial factor, but I think it gets a lot often overlooked.
It does, but it's important to understand that, for example, stem cells, you have over 400 different type of growth factors. So if you're looking for particular growth factors, transforming growth factor beta, the fibroblast growth factor 1, depending on what you're looking for, you have different type of properties for either stimulating cartilage formation, for improving neuroplasticity. You have neurotrophic growth factors. You want to improve the angiogenesis or improve formation of new blood vessels. Stem cells have all of those growth factors embedded in them. So the idea is once they go into an affected area, they sense their environment, and depending on what their environment is, they will start releasing specific growth factors in order to compensate for that. So we're just using this type of product, again, as a biopharmacological product, as you mentioned, like a corticosteroid, for any specific condition.
And there is like, I think, an interesting guiding question, because I could just ask you, like, does it work? And of course, you're going to tell me it does. Otherwise, you wouldn't be working on it very naturally. But
so for example, it does work most of the patients. There's some patients that don't see the results they're looking for. So it does depend on the underlying condition of the patient. I cannot just put everybody or give everybody stem cells if I don't look at the underlying factors of your condition. If you have an autoimmune condition, if you have a neurodegenerative condition, I need to understand what triggered that condition. Because most of the patients spend their entire life without any symptoms. So something must have triggered this. And it's my responsibility or our responsibility to find out all of the contributing factors. If it's gut biome, environmental toxins, heavy metals, mold toxicity, genetics, nutritional deficiency, anything that could be contributing to this condition, I need to tackle that first.
Jacobo mentioned epigenetics studies here.
Correct. So that for me is very, very important, because autoimmune condition is like having a thorn stuck in your foot. That's it. You can take immunosuppressant, you can take biologics, you can take corticosteroids, you can take stem cells, and you're going to feel better. Yes. But you still have that thorn inside. The idea behind the approach that we do is identify the thorn, get rid of the thorn, and then give your body everything it needs to repair.
And this identification is mostly through anamnesis, just, for example, collecting the patient history?
Correct.
Or do you actually conduct, for example, genetic tests on the patients?
We do anamnesis. Again, it's always 80% of the diagnosis. So with the anamnesis, you do have a lot of information. From then, now you need to have confirmatory tests and results. If we're looking for different conditions, we do a genetic test that helps us understand what I mentioned, where I say your default settings, how your body is programmed to process different nutrients. So now that I have that baseline information, your default setting, it gives you a lot of insight of what you need to do to compensate or optimize based on your genes. Then you have a very comprehensive nutritional test that measures exactly how much you have of each vitamin, mineral, antioxidant, fatty acids, and different health markers. You have also epigenetic tests that help us understand any type of DNA or genetic damage that you have done throughout your years. You have immunologic profiles, immunoglobulins, and overall total immunoglobulin A, G, E, M, and specific for different type of viruses. Epstein-Barr virus, for example. You have immunoglobulin G for Epstein-Barr that has been linked to several autoimmune conditions. So if you have an autoimmune condition, let's say, but you have also Epstein-Barr virus, immunoglobulin G excessively high, I need to treat that first. Because there's something called molecular mimicry, in which the antibody that attacks Epstein-Barr seems that the Epstein-Barr capsid, or the capsule, is very similar to your own tissues, some of your own tissues.
Like rheumatic fever, for example.
Like rheumatic fever. So Epstein-Barr virus has been very associated or correlated with MS, ALS. So it's something very similar to neurological tissues. So I do need to see as much as I can before just giving you stem cells.
And this is going to guide your treatment. What specific approach you
Correct.
take?
We have developed guidelines. So this is what we usually offer to most of our patients. But at the end of the day, no treatment is the same than the other. Every treatment is personalized to each individual patient.
But back to my guiding question, I believe you certainly think it works, otherwise you wouldn't be doing this. But one of the questions is, if it works, why isn't it being done elsewhere?
Claro.
For example, why don't we see it spreading and growing in other countries, in the United States, in Europe? Why is it kind of still incipient, still beginning?
Claro. Well, beginning is, it could be debatable. No, the first stem cell description was in 1989, 1990. So it's been over 35, 36 years since of research. I would say it's not being done in the United States, for example, because FDA currently considers mesenchymal stem cells, umbilical cord mesenchymal stem cells, a pharmacological product. Okay? So as any pharmacological product, you need to go through all 4 phases of clinical trials. 1, 2, 3, and 4. The thing is, you cannot patent the umbilical cord. So there's no true incentive in spending billions of dollars funding research for umbilical cord stem cells if you cannot patent and monetize for that. Even though there are some phase 3 even clinical trials with mesenchymal stem cells in the United States. The funny thing is, first, stem cells is not a pharmacological product. Second, the FDA does not oversee other cellular transfusion. FDA does not oversee bone marrow stem cells, for example. And those has been the gold standard of care for leukemia, lymphoma, multiple myeloma. FDA does not oversee other cellular transfusions like red blood cells or platelets or organ transplant, and we all know they save life. So they're considering stem cells, umbilical cord stem cells, like a different product, like a different thing, a pharmacological product. So that's one aspect. I think that's the main aspect of why it's not being done as openly in the United States due to that type of regulations.
Have you ever been involved with you or your clinic with any of these clinical trials?
We haven't, but we run our own type of research. It's not clinical trials, but it's case studies. We do publish different type of case studies, case reports to see and show the results that we have had with our patients.
Have you ever considered doing like a case control, for example, pairing your patients with similar patients and looking back, for example, for patients that have the same diseases? It would have much stronger scientific backing than a case control or case series.
Correct. The way that we have done very similar. We have a control case because most of our patients do come for treatment. It's a very, very expensive product to develop. So we haven't had for doing that type of research on a larger scale. What we have done is protocol A versus protocol B, but both would have stem cells. One would say, for example, you have X amount of stem cells. The other one would have X amount of stem cells plus another product, just to see which one have best results with their patients. But that's the most controlled that we have had. Everybody has stem cells.
Isn't there like a global, a worldwide stem cell institution that's interested in like funding this kind of research or something like that?
Not for research, but for guidelines and making sure what are the criteria that you need to expect or you need to meet in order to have a high quality product and a high quality service. There's different international stem cell International Stem Cell Society for Stem Cell Application. That's one. And what they usually do is guidelines. So these are the type of patients that you should be doing, indications, contraindications, and characteristic of the stem cells. That's something very important. How do you know that it's actually a stem cell? What are the things that you need to have in order to actually have a stem cells? And once you have that stem cells, what viability are you getting? How many of those stem cells that you're giving the patient are alive? So that's a quality indicator. How are you measuring any type of toxins or contaminants? So that's another quality indicator. So most of the societies that are out there is basically to do recommendations, guidelines for safety in these type of treatments.
And you are Panamanian, correct? You went to medical school here in Panama. Did you do your entire career here in Panama as a medical doctor? So my next question will be, why started in Panama? I believe the answer is most likely because you were here and you were familiar with the market.
Exactly.
But have you ever considered, for example, expanding it to other countries? How do you see? Because how, for example, is the regulatory framework here in Panama? You mentioned that one of the reasons not to do it, for example, in Florida or in some place in the United States is because there the FDA sees it in a different way. But I am not familiar with the legal aspects of it here in Panama, but I am aware that there are like jurisdictions that are even more friendly to like experimental research than Panama. To cite an extreme example, the free city of Próspera in Honduras, for example.
Exactly.
So you have places that would be even more friendly and open to this sort of things. So like putting it in the form of a question, why do it here in Panama and not, for example, in Próspera, where the oversight will be even less?
Claro. In Panama, again, it's home. That's one part. It's a hub, so it's easier to most of our patients to travel directly here. There's a direct flight from almost anywhere in the Americas at least. For most of our patients that come from the United States or Canada, most of people speak English here. We're very Americanized. We use the US dollar. So that's easier for most of our patients as well.
Are most of our foreign patients from North America?
Most.
Because you also mentioned that Panama is a flight hub for the Americas. So I do imagine you might get some clients, for example, from Europe or for Asia, but I imagine the bulk will be probably from North America.
Correct. It's actually right. The bulk of our patients are from North America. I do see that they are very conscious or aware about these type of treatments, and they're looking for what would be the best place to get them, and that's why they usually come down here. And besides, they don't have that opportunity there in the United States.
And looking from the point of view of a patient, why would, for example, an American patient come here to Panama for stem cell treatments and not, I don't know, to Turkey, for example? Why would Panama, I mean, you've already mentioned, for example, the ease of access and the cultural aspects such as the currency. Are there any other aspects regarding it?
I think that the experience, the clinical experience that you have, whenever you look stem cells, Panama is always shows first. And once you start looking at the different clinics in Panama, you look at the testimonies, you look at the case reports, you look at the experience and the results the patient have had. I think that will be your, the last nail in the coffin. Whenever you see the results, the experience, the confidence it gives you, and the trust that you can have in the patient, that's usually what will be the selling point.
And so when a patient wants to come, I can't speak about the other clinics, but we can speak about yours. When a patient wants to come to get stem cell treatment here, for example, at the Regeneration Clinic, and they are, for example, American, how does the experience work? They contact you over email, and then the first consultations are over the internet?
Correct. We do have a team of patient advocates that they have all of the information necessary for you if you're interested in stem cell treatments. So they can guide you to tell you more or less what's the treatment is going to look like. Before coming down here, you're going to be having a consultation with any of our doctors, because we need to make sure that first you're eligible for stem cell treatments. Stem cells are not for everybody, and stem cells do not treat every single condition. So that's something very, very important. To see first if you're eligible and you will benefit from stem cells. If not, we need to be very open, transparent about that and tell you, hey, I'm sorry, this is not for you, this is not for this type of condition. We haven't seen good results with this type of conditions. So I wouldn't recommend. So if we do on the opposite, let's say, perfect, we have seen great results for your conditions, you're going to do great. Then you come down here, and then we do the entire, the testing, the treatment, the cares that we do over here. We do a lot of add-ons to your stay to continue optimizing your body for performance, for recovery, for longevity, for whatever your goal is.
And is it like a single visit, or does the patient come to Panama more than once?
It depends. Usually it's at least more or less 1 week stay that they have here in Panama. And we do follow-ups with all of our patients every 3 months. So depending on the follow-ups, so first we're going to monitor your progress. If we see that you saw improvements, perfect. But if we see that 6 months, 9 months later, you saw improvements, but then you reached a plateau, that's when we could consider doing another treatment. If that plateau is still far from where we want to be, we can do another treatment. And that's usually what happens to some patients. I've had patients that had great results with one knee, then they come back a year or 2 years later for other knee or other joint. So,
can you speak values? Are you allowed to give any ballpark, any range of what a patient would be expected to pay, for example?
Claro.
or is that more of a confidential of the camera's
We can talk about
information?
ballpark, because the prices, it varies. It will depend on patient to patient. It will depend on the amount of stem cells and the amount of services that we can add to the protocol. But usually, on average, the treatments could be around 18 to 20, on average. Obviously, you have your outliers, which could be much less, or it could be much higher, depending on
$18,000 to $20,000
$18,000 to $20,000, correct?
for like a whole treatment,
A whole treatment.
or if like it's two knees for one and for
No,
the
let's say an overall anti-aging protocol, and we are very scientific in how we deal with aging. So we have anti-aging protocols and longevity protocols. So we want to be very specific and quantify every possible biomarker that we can. There's something called the hallmarks of aging. Hallmarks of aging are like 12 main roads that lead to aging itself. You can monitor and test and quantify how far you have traveled in each of these roads.
Things like telomere shortening.
Telomere shortening, your stem cell population, chronic inflammation, mitochondrial dysfunction, altered intercellular communication, cellular senescence. So you can actually monitor all of these different parameters to see how far you have traveled, what's your current biological age, where are you standing at this moment, and what can you do to reverse certain changes associated to aging at a cellular level. So that's my approach. I like to be very scientific, there's a saying that everything that can be measured can be improved on. And that's why I try to measure everything that I can.
I actually love that you mentioned this word anti-aging, because I saw here at the corridor that there is like the Regeneration Clinic door, and then there's the anti-aging clinic. So do you regard it as two separate things? Are these two different services? How do you see it?
They
How
overlap.
do you deal with it here?
They overlap because one, you have a longevity and anti-aging focused clinic, and then regenerative medicine. Regenerative medicine, you basically want to give the body everything it needs to heal by itself. So what we need to do over here with regenerative medicine is first identifying whatever is causing you harm, getting rid of whatever is causing you harm, and then giving your body everything it needs to heal by himself. So that's our approach over here. Understanding the thorn, getting rid of the thorn, and then giving you stem cells plus anything else that you may need to heal on yourself.
And are there any ongoing clinical trials about stem cells in anti-aging? Are you aware of it or not?
Not sure, but there's a lot of published data out there regarding about either telomere shortening, about different type of biomarkers for mitochondrial function, chronic inflammation, which is inflammaging. Also, it's important.
You said a lot about scientific approach. Where do you get the protocols, the data from? Because how do you know which stem cell to use? You mentioned that there are societies that publish this data.
Correct.
But are they? How are they coming up with this? Is it based on preclinical trials? How does it work?
So you do have a lot of preclinical trials, and then you also have clinical trials. So again, I mentioned stem cells have been studied since 1989, 1990. So it's been over 35 years. We opened in 2018, so there was a lot of data before we started. So the wheel was already invented. Obviously you have your own propriety, intellectual propriety, that you have your own design for protocols, but everything is based on the safety and tolerability trials. And then you just start tweaking depending on where you're seeing most of the results.
And so how do you see the future of both stem cell treatment and your clinic? Because I saw, for example, that you have expanded into the area of aesthetic medicine.
Mm-hmm.
So you're doing many aesthetic procedures. Do you believe there's like a way to grow the clinic to see more patients of stem cell? Do you see it as currently advancing? Or do you intend to branch off into other areas as well and grow into like that which well established? And I don't want to use this word because it sounds like stem cell is not established, but the more conventional areas of medicine. How do you see the future? Growing the number of patients of stem cell you treat, or actually growing the clinic into more something like a hospital, a small hospital?
Claro. I would say more into innovative products. Stem cells are great. It's in the forefront on research, but there's also more data, more options that you can offer the patients. NK cells. natural killer cells. You can have gene editing. So it's still something not done in humans unless you go to Prospera, the gene editing and the gene therapy. But it's something that we need to study if we want to offer more or add more value to our patients, more value to our patients in the future, for particularly fighting cancer and any type of genetic diseases. So that's part of our research and development efforts. It's going towards there, and just continue finding more personalized ways that we can have a stem cell personalized specifically for you and your treatment. Regarding the traditional views, you have, the four main causes of death worldwide. You have cardiovascular disease, cancer, neurodegenerative, and you have metabolic, like diabetes or diabetic complications. Those are the four main causes of death, the ones most likely you and I are going to die from. All of these, as you mentioned, traditionally, one has been treated with the cardiologist, the other one with the oncologist, neurologist, endocrinologist. But all of them have a true root, the same root. All of these conditions are age-related conditions. All of them are associated with aging. As we age, the likelihood of having any of these conditions increases. So that's why if you focus first on understanding all of these main causes of death, understanding how they work, and you also have the foundations of aging itself, you can help mitigate either the incidence or the suffering from any of these conditions.
And don't you think that it would be important long-term to have like a serious backer for funding, not your clinic specifically, but research in general, like a pharmaceuticals laboratory for stem cell or something like that?
Mm-hmm.
Because I'm not sure, isn't it like a bit out of luck that the advancements may happen now, since it isn't that well formatted, like in clinical trials and all? In other areas of medicine, progress is kind of slow, but it's very methodical, very steady.
Mm-hmm.
And in stem cells, perhaps it's a bit haphazard. It depends a bit of luck because there aren't that many studies happening. So do you think for the next 10, 20 years it will remain exactly as it is now? Do you see it changing the way research is done in stem cell?
Most likely it's going to change if the FDA starts opening up things and giving grants. Have the ability to give grants, because, for example, in the United States you have John Hopkins Stem Cell Institute or John Hopkins Regenerative Medicine. You have Harvard Stem Cell Institute. You have Duke University Stem Cell Institute. So even in the United States, they have major universities teaching about stem cells and teaching about regenerative medicine, but they're not allowed to do it over there. So the information is there, the data is there. You have over 150,000 published articles. So there's a lot of data regarding stem cells, effectiveness, safety, and tolerability. But for phase 4 clinical trials, those are the most expensive ones. Phase 4s, you need a lot of time and a very large amount of volume of patients or subjects for those studies. And stem cells are very, very expensive due to all of the resources it takes, from consumables, from real estate, from man hours, the manpower that you need to do stem cells. So even if you want to, let's say, donate it or do it for a free study, it's going to be very expensive.
No, I don't want to give off the wrong impression that I'm like against any kind of treatment that has not gone through clinical trials, because I am a strong believer in the right to try. I see that it's really a balancing act, because on one side you don't want to do harm, you don't want to use any treatment that's not proven. On the other side, you see this a lot, for example, with some cancer treatments. Sometimes you have a disease that has no proven treatment, and you have a proposed treatment that is unproven, that has not gone through clinical trials. If I was the patient, I would definitely try it. What do I have to lose? Clearly. So it is really a balancing act. How much non-scientific evidence do you accept? You have a treatment that has not gone through phase 4 clinical trials. Is it worth it? Is it not worth it? I don't want to either get the impression across that I'm entirely against any kind of treatment that has not gone through the extremely lengthy and costly process. Because I do also agree that it kills a lot of potentially good treatments. The amount of money and time you have to invest in, you most definitely lose some treatments that had potential and that will not be funded.
Claro.
But I have to kind of give you a segue to talk about your own clinic. So here in Panama, if someone's coming to Panama, why should they come specifically to the Regeneration Clinic?
So what I would say is that we're not a drive-through stem cell clinic. It's not you that you come down here, you get stem cell, and then we send you off. We work differently here, and it's all based on all the tests that we do, all of the effort that we put in finding out what was the triggering factor. What are all of the contributing factors to your specific disease, and what can we do to help you optimize or give you the best chances for success?
You have a lot of patient testimonials both on your website, and you mentioned that previous patients get to talk to new interested patients. How is this organized? Like, how can someone see the previous results? Do you have like a group of papers published on your website?
We have.
Let's say if someone wanted to see which, I don't know, I have multiple sclerosis and I want to see if you have treated multiple sclerosis before. Is that sort of information available? Should someone contact you?
That's not available for the public in the website. We do have a team of doctors that are the ones in charge of statistics, epidemiology, measure and monitor everything. Again, for me, one of the most important things, or the most important thing, is the patient-reported outcome. That's more important than the treatment itself. Because if the patient is reporting you that, hey, my outcome was not good, then the treatment sucked. The treatment didn't work. So the patient-reported outcome is what is going to tell you if you're doing things right or not. So that's why we have a team of doctors exclusively in charge of doing the follow-ups every 3 months. And the follow-ups, it's not like, hey, how are you doing? No, it's doing assessment scales, international standardized assessment scales to put a score or a grade on your condition, whatever condition you may have. If it's something that we can have biomarkers, great. If not, we do the assessment scale. Then you have the database with the assessment scales, with all of the variety, the different outcomes. You have the outliers. That way you're able to, even with that information, you're able to understand why patients did extremely well and why some patients didn't do as well. So now you add more variables to your protocol. Now I know, for example, that if you come only for one knee, I know that diabetic, metabolic syndrome, overweight or obese patients have poorer outcomes only for the knees. So even though you're coming down for one knee, I need to assess and deal the rest of the other conditions just to have better results. Make sense?
Sure.
So it does give a great feedback on our patients, and if they have the data. If I want some report on any condition that we have treated, they can provide that data.
And have you, just to close it, have you noticed any upcoming trends? For example, let's say some examples that the number of patients from one specific country has been growing a lot, or that the treatment sought for one specific condition has been increasing. Have you seen any trends in the industry lately?
The highest incidence that we have seen is in autism. The highest increase, drastically. I think in the 2000 it was like 1 in 100. 2025 it was 1 in 32. 1 in every 32 children have diagnosis with autism spectrum disorder. So there's a huge increase in the incidence of autism spectrum disorder. Be it that it's now being diagnosed more frequently, or now there's more data, but it's still an amazing and whopping amount of patients that we see on a regular basis with more and more autism spectrum disorder. And it does behave like an autoimmune condition. That's something that's most likely you haven't heard of. Most of the patients that have autism have autoantibodies that attack your folate receptor in the brain. So it's something called FRA, folate receptor autoantibodies. More than 75% of these patients have positive FRA autoantibodies, folate receptor autoantibodies. So our approach needs to be different. Our approach cannot be just giving you stem cells. It needs to be a very comprehensive approach to deal with that autoimmunity, and then giving stem cells for modulating your immune system and then repairing or stimulating the repair of any affected tissue.
And how have been your results with autism? Which percentage of patients, for example, get an improvement, and what degree of improvement are we talking about?
Most of our patients, and I say most, I'm not saying a specific percentage, because you have a spectrum. Obviously, the milder you are in the spectrum, the best results you're going to see. The more severe you're in the spectrum, the least results you're going to see. Very similar to an end-stage disease. If you're already bone and bone, I'm sorry, it's going to be very difficult to regain or restore to previous function. But if you have a mild wear and tear, you put stem cells, it's amazing. You still have a lot of tissue left to repair, restore. So it all depends on the starting point, basically.
Well, do you want to add anything? Perhaps something else you think is important to the discussion I haven't talked about yet?
I think we covered pretty much everything. For us, the most important part is safety. Safety is always number one with our patients. So even though some people say that's not enough data, you just look umbilical cord stem cells, PubMed, you're going to find over 150,000 published articles from preclinical to clinical trials. And part of the approach that we do here in the clinic with ISO 9001 certification, being GMP compliant, making sure that all of the product that we produce and we have in our lab has the highest standards for quality and safety. So do your research, look for the clinics, how they produce their own stem cells, and what results have they had. And I think most importantly, don't go to a stem cell drive-through clinic.
Okay, well, it's been a pleasure getting to know you and
Likewise.
see your clinic. Thank you for offering me your studio to record it, and most importantly, your time.
Oh, thank you very much. It's a pleasure.
And I hope to see you again someday.
Perfect. Likewise.
Thank you for having me.
Bye.
Yes. Because usually we ask patients not to report, but in their case we can give you a sneak peek. Yeah, this is right now we're finishing the batches of the stem cells,
And I speak here and became was first outside. Buenos dias, less than usually. Garcia, this question. It was still how is different overstated for us to do today in around 2007. I know we don't fly more so. Thank you for work and give my just like this and you know freely close ends. But like I said, instead of further herb foods are not any third times a day. They're more like separate with their own mental benefit. So this one will step up. And each the food is going to stroke so empty as your eyes they are.